Healthcare is changing rapidly. As healthcare providers, we're being watched by patients, commercial payers, and even the CMS. A recent article in the US News and World Report asks, could a doctor's pattern of referral to and from other doctors say something important about the quality of care he gives his patients? Does a primary care doctor choose wisely when he's referring patients for complex care? Author Fred Trotter, in his recent book, Hacking Healthcare, A Guide to Standards, Workflow, and Meaningful Use, affirms that referrals at least suggest the level of care the doctors provide, if not precisely measure the quality. We at the Eye Institute understand this well. We know that your patients and payers are evaluating you. Therefore, we strive every day to provide the best, most comprehensive, compassionate, and cutting-edge care for your patients. Your patients trust you, and we value that trust. Jack Welch, the renowned CEO of General Electric, was known to say, "The team with the best players win." Our doctors understand this well. By being the best at what we do, providing the best vision care possible for our patients, we ensure that our patients win. Hello, I'm Dr. Vaishnav, vitreoretinal specialist and the Director of Clinical Research at the Eye Institute for Medicine and Surgery. On behalf of my colleagues and our staff at the Eye Institute, thank you for allowing us to participate in the care of your patients and taking time to visit with us. Doctor, am I going to go blind? At the Eye Institute for Medicine and Surgery, I am asked this question by patients nearly every day. The answer for the vast majority of patients, regardless of how serious their eye disease, is no. However, as a retina specialist and a preventologist, it pains me to have to sometimes inform patients that their vision loss could have been prevented. As a medical professional, I am sure that you too get asked by patients how to prevent further complications of their disease, including vision loss. As part of my clinical research and ongoing personally directed efforts to educate patients, I have developed a comprehensive assessment of risk for eyes, or CARE questionnaire, that I can provide to you to share with your patients. My CARE questionnaire can help determine what specific risk factors a patient already has for suffering vision loss, and it is also a useful tool for helping us to identify those steps that can be taken now to minimize the possibility of the patient suffering vision loss over time. The CARE questionnaire, combined with a comprehensive, dilated eye examination and a thorough review of the patient's medical, family, and social history, can help save your patient's vision. Closely coordinating care with each of the patient's other medical practitioners is of paramount importance to ensuring the overall health and well-being of the patient. As a board-certified ophthalmologist, a fellowship-trained retina specialist, and a preventologist, I strive to provide my patients with the best care possible, and I work diligently to do all that is possible to prevent vision loss from occurring. Some of you may be wondering, What types of eye conditions a retina specialist like myself or my partner Dr. Gary Ganaban specialize in diagnosing and healing? As fellowship-trained retina specialists, the focus of our clinical and surgical practice is on diagnosing and treating those diseases where there is a correlation between systemic illnesses and the eyes. Disorders such as those of the endocrine system, autoimmune and inflammatory diseases, vascular and heart disease, cerebrovascular disease, and neurologic disorders, as well as those that affect the retina primarily, such as macular degeneration, retinal holes, retinal tears, and retinal detachments, as well as diabetic retinopathy and inflammatory diseases such as uveitis. Dr. Ganaban and I pride ourselves in being among the most experienced retina specialists in the region. For those of you who may not be fully aware of the range of services provided at the Eye Institute for Medicine and Surgery, as well as our mission, please allow me to fully explain. We have offices in Rockledge, Melbourne, and Palm Bay, Florida. Our mission, first and foremost, is to be Brevard County's premier multi-subspecialty medical and surgical eye care practice, providing a range of services and a level of care that previously was only available at academic institutions. Our medical staff of physician subspecialists include retina and vitreous specialist, cataract specialist, a glaucoma specialist, cornea specialist, functional and cosmetic eyelid surgeons, neurologic and double vision specialist, and a low vision specialist. In addition to their clinical and surgical practices, many of our physicians are invited to spend considerable time outside of clinic hours educating the general public, as well as tomorrow's clinicians and scientists at some of the region's most respected academic institutions. We spend time volunteering and participating in events and on behalf of national and local organizations with the goal of enhancing the quality of life for all members of our community. At the Eye Institute, we have invested in the latest diagnostic technology available anywhere, including spectral domain optical coherence tomography, electrophysiology, automated perimetry testing, digital photography, and fluorescein angiography. We are particularly proud of our early adoption of in-office visually evoked potential and pattern electroretinography, as these new devices provide us with the ability to detect changes earlier than ever before, to help prevent vision loss before it occurs. Dr. Ganaban and I have been fortunate enough to be invited to and participate in research opportunities at various premier research institutions in our nation. We utilize the latest injectable medications designed to halt and in some cases reverse the effects of macular degeneration and other inflammatory eye diseases. We have the most advanced laser equipment available as well. In summary, I take great pride not only in delivering the best care possible, but in empowering my patients to become actively involved in their care process, and in educating them to take those steps that they can that are most likely to prevent or at least minimize the possibility of vision loss in the future. We sincerely appreciate the opportunity to participate in the care of your patients and your loved ones. If your patients, friends, or family members are in need of comprehensive medical and surgical eye care delivered in a patient-friendly, compassionate setting close to home, feel free to contact our office, the Eye Institute for Medicine and Surgery, at 321 722 4443. Again, I'm Dr. Vaishnav. Thank you for your time.